For those living with neck and back pain and other conditions, it's all you'd ever want. Well, our next guest takes a different approach to chiropractic. They'll have you back in alignment and might fix some other things in the process too. Dr. Devin Lazad is here with us now. Good morning, sir. Great having you back.
Back in alignment.
Back in alignment.
Did you write that?
I did.
Well done.
Listen, they don't pay me mediocre
He's
bucks for
better
nothing.
with the years.
You do something different in chiropractic. It's not the twisting, the cracking. It's called the NUCA approach. What is this?
If you prefer the more popping chiropractic, I'm probably not the right doc for you. NUCA chiropractic is a more gentle system, and the theory is if you very gently realign the head and neck, gentle pressure, no twisting, the body can start to balance out underneath, and that can help things like bad head pain, migraines, neck pain, even problems in the lower back, hips, and legs by getting everything in alignment.
See, I think a lot of people, they think you have to go in with the sledgehammer. You got to go in really hard to be able to get the spine in alignment because it can be really stubborn.
Yes.
But this, if you have the right approach and you have the right x-rays, you're able to see exactly where the problem is and you're able to pinpoint exactly where it is.
And it's all about specificity. We take digital opposing view x-rays, some of the best films in the field, and that helps us correct conditions that may not have gotten help with physical therapy, other forms of chiropractic. We see folks who've even been through surgery, have been told, don't go to a chiropractor, you have to have surgery. There may still be hope.
Absolutely. We're going to look at something now. Let's take a look at what we're seeing here and what exactly all of this means.
So the brain sends the nerves all the way down the spine. The nerves come out the side and they control literally everything in your body. So if you have a bone out of place in the top of the neck, that can cause things like headaches, pain into the face, obviously neck pain. This can even cause problems such as allergies. A pinched nerve is not just pain, numbness, and tingling. A pinched nerve can affect the organs. Middle of the neck, that runs all the way down the hands and arms. You've heard of carpal tunnel syndrome. It doesn't always come from the hands. Sometimes it comes from an issue in the neck. So we see that a lot. These nerves also run to something called your thyroid, which is metabolism. Now a little lower in the neck, especially for people who sit at desks who grow these big dowager's humps later in life. An adjustment there can help all the nerves into the middle back where you're having pain. Studies show adjustments to the spine can also affect blood pressure. And I don't claim to cure blood pressure, it's just a neat side effect. How about the middle of the back? When you're sitting at a desk and you've got that pain back there, if you get that bone back into place, can give you relief, middle back, even lower back pain.
So you got to kind of almost think of it like the wiring in a house or something like that. Every single, like lumbar, would that be what you say?
Close, lumbar.
Okay, well, the lumbar, every single vertebrae. There we go.
Good.
Will route to a different part that may affect how that operates.
When I was 13 years old, I told everybody I'm going to be a chiropractor for that very reason. I saw this chart. I said, wow, the nerves run here and there. If you just get the pressure off, the body can fix itself without the drugs, without the surgery and the side effects.
What did the kids think about you back then?
They thought I was a little odd. I thought it was normal, knowing that I wanted to be a chiropractor. I didn't realize I was strange till much later on in life, but I embrace it now.
But you were talking about some of the symptoms that are there, and some of those, I mean, could possibly be helped and affected with this treatment.
Sure, very much so. So when you have and this is a gentle adjusting instrument, in addition to adjusting the neck, what we can do is go into parts of the spine and get the pressure off the nerve. For example, the one running down your arm or even down your leg, something called sciatica, which can then run to the feet. So
yeah, that can cause some numbness down there for sure. We have actually a real life spine.
Okay, so we're going to leave this spine alone and we're going to bring in our
JJ, our real life spine is here, everybody.
Okay, excellent. Hi there. Hi. Good to see you. Go ahead and have a seat. So obviously what we would have done is a full consultation, examination, our x-rays. On day 2, we're going to explain everything to the patient, and then here's what part of the adjustment looks like. Let's say that we found a bone out of place in the upper back. So very, very gently, we use this instrument to get in between the bones, and it gently tap, 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 tap the bone back into place. Also, when you've lost a disc and it's ground down, this can help create a little bit of separation. How about pain in the middle back? Okay. Or if someone's having hip pain, low back pain, leg pain, we can come down to the very base of the spine and gently adjust it down there without any harsh twisting manipulation. I have patients with fusions in their back, bad discs. This can help.
Absolutely. JJ, you were a fantastic spine.
You've been a lovely patient.
Thank you very much. It's worth noting, by the way, you don't just go up and down the back with that and send them off. You have a workup to figure out exactly where the attention needs to be. Let's talk about this workup.
So the key to our success is a 2-day workup. Day 1, thorough history exam, digital x-rays. Day 2, I'm really straightforward with folks. If I can't help, I'm going to get them to the right doc, tell them cost, coverage, everything, because if you like me, you don't want financial surprise.
Of course.
Normally, our workup is $180. For the first 20 callers, we'll do the full 2-day workup for $37.
Wow, that's fantastic. All right, so take advantage of that offer. Doctor, pleasure having you as always.
Great for having me here.
Sorry, we're just hanging around. Dr. Devin, straighten you out using his gentle NUCA method. He has 2 locations. One's in Summerlin, the other one's in Henderson. Just listen for the jackhammer. Visit drdevin.com. That's Dr. Devin, but don't spell it all out. drdevin.com. Or call the number listed. Dr. Devin, a proud sponsor of the Morning